The coronavirus has begun spreading across Africa, with more than 10,000 reported cases so far across 52 countries and over 400 deaths. In addition to the travel restrictions, lockdowns, and curfews, medical scientists are racing to set up more labs to test for the virus, particularly in areas where at-risk households are concentrated.
Our goal is to make sure that we break the chain of transmission and not get to where countries like Italy and Spain are right now.
At-risk households include those with people over the age of 60 and smokers who are more vulnerable to respiratory illnesses. Newsy obtained data from Frame Research showing where at-risk households are in Nigeria, South Africa, and Kenya. In Nigeria, Africa's most populous country, the at-risk households can be found in the Northeast, Middle Belt, and the South. In Kenya, they are located in parts of the Midwest and South. And in South Africa, the hardest hit country on the continent, the at-risk homes are along the coast and in major cities. Recently, all three countries have rapidly enhanced testing capacity. When we compare the location of the testing sites to where vulnerable communities are, here's what we found. Nigeria has 9 testing sites. 7 are in the at-risk areas in the South and Middle Belt. But at the moment, there are no labs that can test for the coronavirus in northern Nigeria. The country plans to expand to a total of 13 sites. Kenya has expanded from 2 to 9 sites, all of which are concentrated in the at-risk areas. Most of South Africa's labs are privately run, but government-run labs will soon go from 6 to 9, 5 of which are in the most vulnerable communities.
If you have more laboratories, it gives you an advantage. You want to test more people as quickly as possible. Also, it reduces the turnaround time.
The World Health Organization and the African Union's Centers for Disease Control are helping countries boost testing capacity and the number of tests they provide.
The best strategy is not to have many critically ill patients. And we are doing that by testing.
In South Africa, with over 1,300 confirmed coronavirus cases, the government has turned to aggressive testing and monitoring.
Around 10,000 field workers at the moment will be visiting homes in villages, in towns and cities to screen residents for the coronavirus symptoms.
Yet testing remains a luxury for some African countries.
For those countries that don't have the capacity to do the testing, and those are relatively few now, we have a mechanism where their samples can be able to be transported to the nearest laboratory that can be able to do it in a neighboring country.
The continent has learned invaluable lessons from combating infectious diseases like cholera, meningitis, and Ebola.
In terms of outbreak response, the mechanisms are basically the same. The only thing that makes the difference is the peculiarity of the disease you are dealing with.
But with few resources and staff, authorities are rushing to contain the spread of the virus in Africa.
The health systems are fragile, and adding COVID-19 to it is a recipe for something that is quite unpleasant.
Chidima Irene Woye, Newsy, Washington.